electronic health record, as the name implies, one patient, one health record, is to cover his whole health journey in a summarized and contextual manner.
This is beneficial for us as emergency physicians. When I see the information presented to me from that portal, it is very much the source of truth. Therefore, we can rely on that to make snap decisions for our patient.
We can get more detail from the NEHR so that we can give better care for the resident.
We can assess the patient history, irregardless where had the patient received the care.
In addition, I can see their recent blood tests and investigations, leading to cost savings for my patients.
And with that, we could then move on to a sort of a smart system. And I see a lot of communication going on with the NEHR infrastructure and with the ground, so I think that's very encouraging.
In 2008, the Ministry of Health Singapore embarked on creating the vision of one patient, one health record. The National Electronic Health Record, or NEHR, integrates and shares patient records seamlessly across the entire nation's healthcare network.
I think we are all excited, whether we are caregivers, planners, or even, I think, certainly for the patient. With the coming of the digital age, we are no longer confined to medical records that are stuck in one institution, and that we are able to see things digitally across our connected healthcare environment.
Well, the NEHR system can support the national health system by being a national integrator of medical information. And in that light, I think it complements the more intensely used regional health systems' electronic medical records.
As time has passed, the speed at which we retrieve the healthcare information has now shortened considerably. So knowing that there's this source of information behind me to treat my patient gives me confidence in treating the patient better.
To me, NEHR can make my viewing faster, and we can serve the patient as fast as we can. So we can see the patient's drug allergies, medication history, like prescribed medicines from other institutions, as well as dispensed medicines, and also the lab results. It will highlight the abnormalities straight away. Because you can view the data from all other organizations, that's how we can prevent duplications or interactions of medication.
Overall, I find that NEHR has helped to offer better integrated care for my patients. I find that it's quite easy to access as well. I'm able to have a better understanding of patients' medical and drug history, as I can tap into the medical records from the specialist clinics and the polyclinics. This is important as some of my patients are unaware of their own medical conditions.
Before using NEHR, we have to rely on the staff, what they are telling about the resident. But now we also hear from the nurses, plus we can also see the system to know more about the resident, what is happening in the hospital. In one view, we can get more information from the NEHR. It makes my work easier.
Patients with chronic illnesses, of course, will particularly benefit from this, simply because there are so many medical problems. They see so many doctors out there, and they are on so many pills. Most GPs out there are actually run by either individual solo GPs or small groups. But by having an NEHR, is in fact almost as if you're plugging into a much larger network with a lot of resources. I would say information gives you power to take care of them better. Ultimately, better care for your patient translates to better doctor-patient relationship.
And this is just the beginning. We continue to develop enhancements that evolve with the ever-changing needs of clinicians. The NEHR is building the foundation for connected health by enabling better quality care through better technology, strengthening the health of residents. We are on the road to keep Singaporeans and residents healthy. One patient, one health record. National Electronic Health Record.